Cutting edge of new technology in medicine, but this new cutting edge technology, Pittsburgh seems to always be on the cutting edge of new technology in medicine, but this new cutting edge technology could mean the difference between life and death. Some local doctors are the only ones in the entire country using this new tool when it comes to trauma care. Sarah Arbogast has more on how it works.
April 9th, 2014. Chaos at Franklin Regional High School in Murraysville. Police say a 16-year-old student went through the hallways, slashing and stabbing nearly 24 people. Several of those victims were rushed to nearby Forbes Hospital, a hospital that just months earlier had been accredited as a Level 2 trauma center. The team proved it was ready to tackle a trauma situation. That same trauma team at Forbes was again thrust into the national spotlight and put to the test this past weekend when 3 people were shot inside Macy's at Monroeville Mall. While the trauma surgeons are clearly proving their importance in the eastern suburbs, they're also leading the way with some newly developed technology.
Start trauma team leader.
Forbes Trauma Medical Director Dr. Chris Kauffman, along with other trauma surgeons and a physician's assistant, have been using the new technology for about 2 months. They're the only ones in the nation testing it out. They've been wearing Google Glass in conjunction with software called VIZR. It's specially designed by a surgeon for trauma settings. Kauffman says the technology would have been helpful during Franklin Regional, but it's useful in any mass casualty incident.
We have a patient that needs to come in, have the bleeding controlled, go to the operating room. We have to keep moving with those patients.
The software has already been used in different scenarios, especially with car crash victims who often have multiple injuries. Surgeons can call up specific checklists depending on the particular trauma.
Trauma surgeons are the fighter pilots of medicine. Just like fighter pilots use checklists before they fly, this Google Glass technology allows us, as we prepare for patient arrival, to review what we're going to do.
In addition to the checklists, doctors can choose to receive prompts every 2 minutes. Those reminders are critical during a trauma when the first few minutes can mean the difference between life and death. And when, in unusual cases, trauma docs don't have the time to reference outside sources.
Reminds us when to start antibiotics, reminds us when to ask the team, are we ready to go to CAT scan or the operating room?
So many things happen to a patient that can ultimately cause irrevocable damage. So the more timely the care of a trauma patient is, the more likely that the outcome is going to be positive.
Patient privacy was a big concern when designing this new technology. You'll notice on all of the glasses there's this little tab covering up the camera, so at no point is the device recording or taking pictures of a patient.
That's why patients are referred to as patient 1, patient 2, patient 3. Names are not used.
We designed a study to look at the patient perception of this technology, and so far with the patients we've accrued in the study, we're getting some pretty positive information.
Surgeons here at Forbes are also giving it a thumbs up. And although right now they're the testers of VIZR with Google Glass, they expect the technology to spread.
I predict that in the future, every trauma surgeon and potentially every emergency physician in this country will be wearing a technology like this.
In Monroeville, Sarah Arbogast, KDKA TV News.